Speech therapy can cover specific symptoms of Parkinson's, as Mrs. Jones said. Loudness is not the only one. LSVT, the Lee Silverman voice training, as you've all heard, is incredibly effective. But the same principles that make LSVT effective make other treatments for other symptoms of Parkinson's effective. It's the same principle for loudness as it is for walking. Think big, think loud, get those muscles moving, strengthen them, build a habit of getting your body to move the way it's supposed to. You can fight the Parkinson's. I love treating patients with Parkinson's because there are effective treatments, and I specialize in neurological communication and swallowing disorders. And so there's some sad things that, sad diagnoses that I work with. Parkinson's is, as far as diseases go, one of the happy ones because you really can fight it, and I want you to know that. And I want to empower my clients with information. It's already been talked about what causes Parkinson's. Dr. Bixby talked about dopamine. The cells in the brain that produce dopamine die off. So we know what causes Parkinson's. We don't know why those cells die off. If we knew why, I wouldn't be treating Parkinson's anymore, and I would be really happy. So Dr. Sherman, the research neurologist, dig deep. Is he here? I want him to dig deep. I want him to figure it out. So the symptoms we treat as best as we can. There are a lot of Parkinson's symptoms. This list is not comprehensive. I mean, there have been symptoms talked about today that I didn't put on this. Since Parkinson's is a movement disorder and the bowels move to push the stool out, that can be connected to Parkinson's. And believe it or not, I mean, you need to speak with your doctor about that. There's medications that can help. But I work with the throat, the voice box, the lungs, and so I can teach you efficient ways to make your upper body stable, which can help even with passing stools. So I take a very individual approach in what I treat with speech therapy. Mood and hallucinations. I put those at the top of the list because there can be a stigma about hallucinations. Hallucinations can be caused by, as part of Parkinson's. Everybody's symptoms are different. And if you're getting that, you need to talk to the doctor about it because there's things that can help. There's medicine. Or it's been talked about that one of the side effects of Parkinson's meds is hallucinations. Isn't that interesting? Too little dopamine and you get Parkinson's. Too much, hallucinations. So if you're experiencing that, you got to work it out with the doctor. What's causing it? Is it Parkinson's dementia? Is it a side effect of medicine? Medicine is amazing stuff. The brain is powerful, so getting the right medication is a process. It takes some work, some fine-tuning. And that's not what I do, but I want you to know that because I care about my clients overall as a person. The hallmark of Parkinson's, the theme that ties it all together, even though everybody has different symptoms, is movement. You mess with movement and it affects a lot of things. Walking, arm movement, posture, communicating. As I said, the prognosis for Parkinson's is good. There are effective treatments, and I want you to know about them. So Parkinson's is progressive. It's always trying to progress, but if you combine medication with behavioral treatment, with some speech therapy, some physical therapy, you get the best outcome. You don't want to just take your medicine, your carbidopa, levodopa, or whatever medicine you're on, and leave it at that. You gotta work. You gotta do the exercises, just like Dr. Bixby was talking about. Are you doing your exercises? These charts here, hand drawn by Noir, very research-based. Actually, I just drew these up based on what I have seen working with Parkinson's patients. The earlier you fight a symptom, the better. So the blue line, see that little dip, and then it kind of stays high and it's up and down. Fighting Parkinson's is like trying to keep a good weight around the holidays. You gotta keep fighting it. This red line here, at any point, if you stop doing your maintenance plan, Parkinson's will progress. And so you always gotta fight it. If you stop your exercises for a week and get right back on the horse, it's okay. But you don't want to go a long time without doing your maintenance. The lower one kind of shows what I've experienced with, if I work with somebody who's, their Parkinson's has progressed. Usually it's not their fault. They didn't learn about these treatments early on. That's kind of what the outcome looks like. I make some gains with them in whatever we're working on, but it's not as significant as I would like. Here's some principles for you to stay motivated to fight your Parkinson's, because you go to a doctor, you go to a therapist, you go to all these different people, and we give you exercises and we give you things to do. It's a lot of work. Pretty soon you're having a full-time job fighting Parkinson's. Pick your battles. If it doesn't matter to you, like, oh, I don't know, handwriting. I can treat handwriting, but you might have bigger fish to fry. It's up to you. Usually people say, my husband or my wife handles the bills, so they can do the writing. I present to you what I can work on, and then you choose. The doctor, the therapist, whoever you're working with, demand education from them. Don't let them just say, do this exercise. Ask them why. My goal in therapy is to not keep you forever. I want you to get back to your life and to be able, as much as possible, administer your own therapy, really. Once I discharge a client from therapy that has Parkinson's, I check back on them now and then, and we do refresher courses, but it's not about keeping you coming to my clinic, because I want you to live your life. And I do start out therapy intensive 3 times a week, and then I taper to 2 times and then 1 time, and then after that it's refresher courses. That's the approach I take with Parkinson's. And I teach you this other tip: get back to living your life. As much as possible, any Parkinson's exercise, if you can, combine it with something else, like watching TV, and it becomes a passive exercise, then you're more likely to do it. It's hard to get up in the morning and do a 2-hour exercise routine, but hey, I can teach you some swallowing maintenance exercises that you can do while you're riding in the car. And it works. It's a good maintenance strategy. There's a lot of different people that you can work with in the medical world. I put this up here because the medical world is very complicated. There are a lot of people. Who do you go to for Parkinson's? The neurosurgeon, there's the person that handles deep brain stimulation implant. That's one of the best things for tremors. There's other things you can do, but pharmacists, if you find a good pharmacist, you can pick their brain all kinds at Walgreens or CVS, and sometimes they find something the doctor hasn't found, and they put you on the right track. The healthcare workers that I put in bold are what I consider a kind of a mandatory, ones you want to see. The reason I put neurologist is because I hadn't heard what Sarah said, that you want a specialist in Parkinson's. Not every neurologist is necessarily a specialist in Parkinson's. I put neurologist up there because I happen to know some really good neurologists for Parkinson's disease, and I'll tell them to you. Your alliance probably already knows about them, but if you don't, there's a few really good Parkinson's neurologists in Tucson. I also put physical therapist up there because one of the most dangerous things with Parkinson's is that you stumble, fall, and get a concussion or break a hip. And you don't want that to happen. So that's kind of a mandatory thing, keep those legs moving. The big therapy that was talked about, that Dr. Bixby talked about, it's actually retraining you, recalibrating your brain to take a big step when you tell yourself to. And it works. It's a constant battle to keep your gait good and big, but it's worth it. And I do a bit of a refresher on big because, are there any physical therapists here? No? Okay, good. If you haven't got a good physical therapist for Parkinson's, sometimes I end up picking up the slack because I'm not going to sit back and let you take a fall. And I know the big program, so I can do it. Speech therapist, I put that as mandatory because of this swallowing issue and communication. If I give you a list of symptoms you want to fight, most of you will say, I want to keep communicating. It's frustrating when my friends say, what did you say? What did you say? So those are important things to address. This here is the list of mostly everything I address in my Parkinson's program. So this is what speech therapy can do. Decreased loudness definitely affects communication. Some patients with Parkinson's have slurred speech sounds, and that presents differently. There's different ways the speech can be affected. But that's why it's important to realize it's not only the loudness. The speech really can be affected. And there is a treatment that's as effective for articulation as LSVT is for loudness. Swallowing is important for overall health. And so I always treat that, even if you don't have many symptoms with it, because I'm going to teach you preventative exercises to avoid swallowing problems. Other things I treat: masked facial expression, monotone voice, and those are optional. Some people just have a monotone voice, like me and my dad. I got it from him. Thinking and memory difficulty goes with Parkinson's, but it's usually so minor it's not classified as a cognitive disorder, but it is there, and I recognize that, and I do work with people on memory and handwriting. So I'm going to give you some freebies on swallowing. Am I good on time? Okay. And any swallowing problem is individualized, so what I do in speech therapy is analyze what's going on with your swallow, the pattern I see, and then I'll give you individual exercises for it. But today I'm going to give some exercises that are just good for anybody, no matter who you are. But you had a question?
Yes. Why did you skip drooling and excess saliva?
That's actually related to swallowing. Thanks for bringing that up, because you're thinking, what about that? You may think, oh, my mouth is producing so much saliva. What it actually is that you're not managing the saliva. You're not swallowing as much throughout the day, because we all swallow, I don't know, some books say 2 times a minute, some say 6, some say 1. But the point is, if you don't swallow, the saliva builds up. One of the first symptoms that your swallow is starting to be affected is that you start drooling a bit. And if I can nip it in the bud right then and there, if I can get doing therapy with you at that point, if the drooling has just started, we get the swallow back to normal and the drooling goes away. The sooner we catch it, the better. I do have an electrical stimulation device that I put on the neck that stimulates, it contracts muscles for the swallow, and that can enhance the exercises that I do for swallowing. it does some cool stuff, and I've seen some really good results with it. But the exercises I'm going to show you, you can just do on your own. One of them is simply swallowing, dry swallowing. Yeah, to exercise the swallow, you have to swallow. Took a master's degree to figure that out. So it's easier to swallow food, that delicious pizza. If you're starting to drool now, it's because you're thinking of the pizza. It's easier to swallow when something's in your mouth than it is to swallow when there's just saliva in your mouth. So having an empty mouth, what I call a dry swallow, creates a bit of resistance so that it takes a bit more work for you to get those swallow muscles going. And we can't put a dumbbell on the throat to make you lift a weight with your throat. So what we do is this dry swallow exercise. The electrical stimulation creates resistance that you then work against with these swallow exercises, and that's partly why it's so effective. But if you do 10 dry swallows in a row, go ahead and just try a swallow. I want you to be aware of what happens. Your throat, the whole thing moves up and then back down. And in that short amount of time that it's up at its peak, everything closes off to protect the airway. Food passes over the airway, goes down the esophagus. The esophagus opens up and lets that food down. So dry swallowing is strengthening the muscles that lift the throat and get it into place. If you feel it not going, and you're like, come on, and it's a pain, try taking a sip of water, wetting your whistle, swallowing that, and then doing the exercise. And that's not cheating, it's just priming the pump a little. So honestly, if you aren't having swallow problems and you do that 3 times a week, or just when you're watching TV and you do it consistently, it keeps the Parkinson's from affecting the throat as severely. Let's see, what other exercises? Oh, singing. Singing. Who likes to sing? If you're able to sing. Would you come up here and, no, just kidding. Singing is a good throat exercise, and depending on where you are at with Parkinson's, it may or may not be something you want to do. I give voice exercises, and it strengthens the voice, but you can't disassociate voice and swallowing. They're connected. What else? Here's something very important. Good oral hygiene. That is a greater indicator of getting pneumonia from swallowing problems than the swallowing difficulty is by itself. Because the danger is not having a little spit or a little food go in your lungs. The danger is having a germ go in your lungs. And so if you keep your mouth clean, the swallowing difficulty and the coughing on food is less of a problem. It's still important to address the coughing and try to get that under control. So there's the dry swallow exercise, and then just one more I'll show you, and then I'll be done. And you can ask questions and you can eat pizza. Before you get up in the morning, take your pillow out from under your head and do this. So you're lying flat in your bed. You can't see me, can you? All right. And you basically are doing a sit-up with nothing but your head. You're not using your shoulders, you're using your neck. And you lift the head up and then put it back down. And you do that 10 times in a row. And then you rest and you see if you can do another 10. So you do a set of 10 head lifts. And then it's also important after that, you do one where you lift your head and you hold it. You try to put your chin on your chest and you count to 10. And then you let it down and you try to do another one. And you're putting this video online so you guys can watch these. I'm basically giving you just a very general swallowing maintenance plan. The head lift exercises and the dry swallows and the oral hygiene. What the head lift does is it strengthens muscles related to the swallow structures, but it also stretches the esophagus. And when you stretch the esophagus, you make sure it's opening enough for when food goes down the chute. Because when you get older, that sometimes tightens up. And so it's not the primary cause of the swallowing difficulty, but if your esophagus isn't letting the food go down, then the food can get stuck and then you can start coughing on it. So those are the exercises I'd recommend to everyone.